Hello all, this is Dr. Shilpi Reddy and we're discussing about female sexual dysfunction. Female sexual dysfunction is very less discussed, but yes, I know when you should come to a doctor when you are having an issue with your sexuality and sexual dysfunctions. These points are very important in guiding you actually when is the right time to see the doctor. Whenever women face difficulties in sexual activity, thought of sexual activity or the desire for sexual activity, they can at times take it as a phase in their life and they can forget or they can postpone things. But when sexual problems are affecting your relationships, that is when women take it as a challenge and come for counseling or come to check what is the thing that is taking them away from a relationship that has to go smoothly. So any sexual problem that is affecting your relationship can be one of the way that you should come and see the doctor. So whenever women have worries about their sexuality, that can also be one of the time that actually you can come and see the doctor. And to see the doctor can be a very emotionally draining thing, but yes, you have to take challenges when you really have disturbances in your life, and how to talk about problems like sexuality and sexual dysfunction, especially when it is concerned to females. It is a daunting task, but put your foot front when you have had bad experiences haunting you, and when your bad experiences are the reason behind you having a sexual life. And if you have a history of sexual abuse and the sexual abuse history is haunting you, then definitely you would need help and you need to talk to a doctor immediately. And if the concept of say female sexual dysfunction is hindering your own comfort and your own life, then definitely you have to come and check to a doctor. And when to see a doctor is definitely a very skeptical thing. People do come to a doctor when actually they have been completely down, and that is not the right time. Then we really want to see them. We want to see them when they have actually had a problem in the initial stages of problem, where you can actually deal with the problem and just get out of the situation. There are phases of time, people with fertility issues, people with pregnancy, people with childbirth and child care, they have an enormous time and gap with their sexuality and they are devoid of sexual activity, and that actually is very difficult to handle and treat, because long gaps of absence of sexuality, again, to build up that chemistry is little difficult. So you have to see the doctor as soon as you feel that they are coming as an hindrance in the relationship between you and your partner. And to see a doctor for female sexual dysfunction is definitely the need of the hour, because women also need to have their own sexual needs and their own environment friendly sexuality. And when we talk about the doctor's role in such things, you can have your own tips and tricks how to deal with sexual dysfunctions during fertility treatments and during your pregnancies. And in our society, still pregnancy means a gap of sexual activity, but then that much is not needed unless you have any critical conditions that are supposed to be refraining you from sexual activity. There is no need of actually refraining yourself from sexual activity. And child care, again, post-delivery child care and body image issues, there are several problems during pregnancy and childbirth that are causing a lot of problems, and this is when you actually need to see the doctor if you see any vacuum or lacunae in your sexual activity, especially during perimenopausal years, when there is a little bit of fat accumulation and you are dealing with obesity issues or any multiple problems like diabetes, hypertension, cholesterol problems, and multiple medications causing a lot of less desire in sexual activity. These are the times you should support yourself with a doctor's appointment for female sexual dysfunction. So the phases in life come and go, and every phase in life is in itself a special phase, because you've not gone through it before. And for people who have gone through these phases again and again, like pregnancies and childbirths and childcare, they should be able to help themselves with the experience of what they have had and what changes they would like to have in the next pregnancy. So that should be a planned thing, and you should never give this as a reason to having a sexual dysfunction. And especially women at menopause do have a lot of problems in sexual activity because of lack of the hormones. So definitely a doctor would be able to help you deal with these kind of problems, which are actually physically, physical inhibitions like hormone deficiencies and lubrication issues and dryness issues and all these things. So these are the times that are very, very important phases in women's life to enter into the chamber of discussion of the female sexual dysfunctions.